do a quick video. Can I get a little high?
Hi.
Nice, thank you.
My name is Daphne Gomez. Today I'm going to be teaching my mom about ICD-10-CM coding training. So to begin, I need to explain what ICD-10-CM is. It is the code set used to do diagnostic coding in the majority of healthcare settings. The direct definition is the code set used for coding diagnoses in inpatient procedures. And it was authorized by the WHO, or the World Health Organization, and it has had 10 revisions since its conception. The other portion of it, which would be the PCS, would be for procedure coding, which would be only in inpatient hospital settings. We're mainly going to focus on just diagnostic coding. Okay. And since my mom is also a Spanish speaker, I made a portion of the lecture in Spanish so that I can explain it to her. Entonces, para explicarte a ti, porque quiero que entiendas, es la clasificación internacional de enfermedades, la 10ª revisión para la codificación de diagnósticos y procedimientos. Es un conjunto de códigos que se utiliza en entornos de atención médica con fines de facturación, investigación y mejora de los resultados de los pacientes. Los códigos diagnósticos se usan en todos los entornos médicos, y parte que es como para los procedimientos es nada más en entornos de atención médica para pacientes hospitalizados. Okay. El formato del... Okay, well, it froze.
¿Lo paro?
No, it's fine. The TV froze, but I mean, ¿sí lo puede leer de ahí?
Sí.
Okay. Well, if you can read it from here, I'm so sorry. Okay. So the format of the ICD-10-CM, it has 7 parts to it. So it would have the first part, which is the category, the next part, which would be category, atomic site, and severity, and the last part, which would be an extension. So the first category, or the first, how do I explain it? The first part of the code has to be a letter, except for the letter U, and then any other portion would be a number or a letter in a number. And majority of the codes happen to be in this format. It can be smaller or it can be larger. It just depends on like how specific the code is. Entonces, para explicarte, cada código es 7 partes. Siempre va a empezar con una letra, menos la letra U, porque se pueden confundir a vez en cuando. Si tienes preguntas, me las puedes preguntar. Y a vez en cuando usan la letra X para poder poner como para un placeholder. So sometimes you can use the letter X as a placeholder, but you always have to make sure that the code is completed by the time you're about to send it out for billing or coding.
Okay.
An example of it would be the code J11.2, influenza with gastroenteritis. Influenza due to unidentified influenza virus with gastrointestinal manifestations. And I got most of these from the 3M code book, so in a second I'm going to tell you what that is, okay? Okay. El código es el J11.2, que es influenza con gastroenteritis.
Ok,
y
muy bien.
Así es como se debería ver, ¿verdad? Por ejemplo, esta parte de la J es el category de los diseases respiratorios. So, For example, the J here would be the portion or the category for respiratory diseases in the respiratory system. Okay, so for this part of the lecture, I'm just going to be showing you 3 steps on how to do the coding because there's a lot of steps and I don't want you to get overwhelmed. Okay, so the first step is we're going to locate the main term in the alphabetic index. The second part, we're going to find the code number that we found in the alphabetic index in the tabular list. And the third step is we're going to make sure we check for any additional notes, exclusions, laterality, or any subterms that we find in the tabular list once we find the code. Okay, para explicarte, la primera parte hay un como índices alfabético que se busca primero el código y después de eso vas a buscarlo en una lista tabular donde tiene más como explicación, ¿verdad? Y después buscas todas las notas adicionales que puedan tener. Okay. For examples of code books, I'm just gonna. So these are the kinds of code books that you would be using or coding systems. This isn't a ICD-10 book. This is a CPT code. This would be used for like outpatient settings or just very specific settings. It's not the same as the ICD book, but it's similar. It would be sort of like this. It would have like an index, and then a list, and then it goes more in depth with the categories and the body size. And then this one, I just like using this. It's a medical dictionary. It has, if you get confused with sometimes the terms in medical terminology, it gets confusing. So I like to use this to just find terms I'm looking for. Now for these, it's similar. This one is an actual ICD-10-CM book from 2023. And it was made by the AMA, or the American Medical Association. And then we have sometimes in certain, healthcare settings, I've used this one. It's a neurosurgery or neurology code book. And it's a specific code set or code book made for the specific kind of healthcare setting you're in. And that will include more than just CM or PCS. It'll have CPT or HCPCS codes. And then the one I'm going to use for my examples will be the 3M encoder with the ICD-10-CM and PCS codebook. If you can see here, there's the alphabetic index and then the tabular list. Para que entiendas, esta es la que he usado para cuando me voy al hospital a hacer mis prácticas, es de neurocirugía. Y esta es la que vamos a usar, esta es la que uso cuando hago mis tareas en línea.
Okay.
Va a tener las porciones que estaba diciendo en la última parte. En la última parte. Ok. Parte 1 es buscar la condición en el índice alfabético. So the first part would be to find the main term in the alphabetic index, and that it would be used to find the correct code. So the alphabetic index is an alphabetic list of ICD-10-CM terms put into categories, which the coder can then use to determine which sections to look for in the tabular list. There's a main term, which would be what you're mainly looking for the condition. And then there would be subterms underneath it, usually indented into like a little bit to the side. The example here shows for dermatitis, which would be the main term. And if you wanted to, for example, you have documentation and it's a sort of like an ammonia burn or something like that, it would be a subterm. And then there's further indentation for more categories. Entonces, como por ejemplo, si tienes dermatitis, buscas aquí. Y esto sería como cuando andas como en un dictionary, ves que a veces cuando andas buscando una palabra, Y pues buscas ahí.
Te dice la
tipo.
descripción
Sí,
de
la-
lo que
Ujú.
es.
O por ejemplo tienes un diferente tipo de dermatitis, entonces buscarías
El término.
subtérmino. Ujú.
Ok.
Otra vez voy a usar el mismo porque
Ujú.
es la que yo uso. So I'm using again the example with influenza with gastroenteritis. So the main term would be influenza, and then you would go down and you would find like I guess connecting word, which would be with gastroenteritis, which would be a subterm. So that's mainly what the alphabetic index is, but you don't have like the full description of what you're looking for yet. And you should never code with just the alphabetic index. You have to do first alphabetic index, then tabular list.
Ok.
Okay, so we have verify the code in the tabular list, which would be our second part. Verificar el código con la lista tabular, y es para confirmar que ese es el código correcto.
Oh, ok.
So the tabular list consists of 22 chapters covering all diseases. And again, this is what I've mentioned before, never assign codes without looking at the tabular list, because there's more detail in the tabular list for the codes to assign. Y aquí es donde buscarías como las notas de exclusión.
Ujú.
Esencialmente, tú sí entendiste, ¿verdad?
Sí,
Aquí,
estoy
gracias.
haciendo lo que me dijiste en inglés.
Cool. Okay. Esto sería como la lista tabular. Aquí sale todo, como la descripción, tiene todas las notas que deberías ver, como por ejemplo si puedes usar este código o si necesitas agregarle este para asegurar que sea completo el código.
Ujú.
Okay, so basically this part is what you would use to find the main term or the full description. You would use this to make sure that you have you check all the exclusion notes if there's additional codes that you need or additional parts to the code that you have to add to make it complete.
Ujú.
Okay, and our third step is other rules for coding, and it's mainly making sure you check all your notes that you have in the tabular list. So I put a note here for what kinds of exclusion notes they have. There's two types. The first type that you will find would be used to indicate when two codes can't be used or when you should never assign two codes together. And the second one is a bit more difficult to explain, but I'm going to try to anyway. It's used to indicate that the excluded condition is not part of the code, but it can be used if you have enough documentation to prove that it needs to be coded together.
Ok.
¿Qué te lo explico?
Si quieres, pero sí te entendí.
Ok. Bueno, a este primer tipo es ese exclude note número 1, que significa si lo ves, nunca deberías codificarlo con el otro código si está en la misma parte.
Ujú, ujú.
La segunda es más como si tuvieras dos códigos que ves como en documentación, y si tienes la documentación ese sí lo puedes codificar, pero hay otro código que puedes usar que es mejor
Oh,
para esa situación.
ok.
The example I used for this part is the I-10 code, which is the code for hypertension. So, kind of hard to see here. Basically, right, we would find it here in the alphabetic index. We would type in hypertension. You would find it here, and then it would take you to the tabular list, which it would give you more information on the code. Here it says essential primary hypertension, and it tells you what it includes, and then it has here two exclusion notes. The first one says that you can't code it with hypertensive disease complicating pregnancy, childbirth, and perineum. Esencialmente aquí dice, aquí te enseña el código para hipertensión. Primera nota de exclusión te dice que no lo puedes codificar con este tipo de hipertensión que es para como que tiene que ver como nacimiento. And then the second part is the second exclusion would tell you which ones you shouldn't code with, but you could if you have documentation, which would be essential primary hypertension involving the vessels of the brain or the vessels of the eye. Pausalo un poquito. Necesito agua.
Yeah.
Okay. We have step 3, other rules for coding, continued. We have multiple coding and additional notes. So sometimes you'll have a code that has you have a code that needs to use more than one code to explain the full documentation. And you will find words like with, due to, and secondary to for those kinds of codes. And with the example code that I have here for chronic kidney disease stage 4 due to type 1 diabetes, we have that kind of example. So for here we have one code that explains the diabetes mellitus part, which is type 1, to the underlying condition with diabetic chronic kidney disease. And then the second part of the code would be the N1 8.4, which would be chronic kidney disease stage 4. So right here in the tabular list, it shows this first code, which covers the diabetes mellitus. And then it says here, use additional code to identify stage of chronic kidney disease. And it would go from these codes, which is from N1 8.1 to N1 8.6. So you would have to code it with one of these to make sure you have the complete description of the code.
Okay.
Okay, other code rules. This one's pretty basic. It's laterality. Sabiendo cuál parte del cuerpo, si es el derecho o el izquierdo. It's very important to check for laterality when doing diagnostic coding. An example of this would be a sequela of an old crush injury to left foot. So you would have to look for a code that shows that portion. So, see if I didn't put an example. Practice problems. Okay. Hice unos problemas de práctica para que veas si me entendiste o no.
Okay.
Okay, so I made some practice problems to see how well I am teaching my mom. Okay, so the first practice problem, a patient was admitted to the hospital with type 1 diabetic gangrene. What is the correct code assignment? Entonces, un paciente fue admitido a un hospital con tipo 1 gangrena diabética. Y aquí salen los codes aquí. Aquí son todos los codes que necesitas, nada más vas a buscar uno. Entonces no vas a necesitar ver aquí esta porción donde te dice qué es.
Okay.
Y aquí voy a dar unos puntos.
El gangrena sería la diabetes tipo 1, E1052.
You were right.
¿Eh?
Look at you. You're learning. Okay, practice problem number 2. The patient is admitted with prepatellar bursitis following a crushing injury to the left knee as a result of being hit by a car 2 years ago. What diagnosis codes would be assigned for this patient? Entonces, para explicártelo bien brevemente, tiene un problema de le pegaron con un carro 2 años atrás y tiene problema con esta parte, la izquierda. ¿Cómo se dice?
La rodilla.
La rodilla. Y
fue admitido con bursitis prepatelar.
Ah,
Okay. Y este tiene 2 códigos. This one has 2 codes.
ok. Left. La M7042. Y la S8702XS. La última.
La última.
La segunda y la última.
You were right. Oh my god. Sí
I was
sabía.
right?
Yeah, you're right.
Yay!
Good job. Can I get a little high five? Nice.
Yeah, I say the second one and the last one.
Yeah, okay.
Uh-uh.
Sí sabes que es una secuela, ¿verdad?
Sí.
Okay, cool. Okay, that was the end of my coding presentation from my mom. Thank you so much for letting me teach you. I really appreciate
You're
it.
welcome.
Okay.
Was too nice learning.